Dimapur and Perin continue to remain the worst hit districts with 40 fresh cases of COVID-19 reported from the districts today. The good news is that 14 more COVID-19 positive patients recover from Perin. India becomes third country to cross 10 lakh COVID cases. Total coronavirus caseload in the country surged to 10,03,832. And at least 80 people have lost their lives due to flood, erosion and landslides in Assam. Chief Minister visits flood-affected areas to take stock of the flood situation. Well, those were the headlines. Hello and welcome to News and Trends. We begin this bulletin by taking a look at the COVID-19 update from Nagaland. A total of 40 fresh cases of COVID-19 were reported from the two worst-hit districts of Nagaland, that is Dimapur and Perin. State's Health and Family Welfare Minister Assam informed this in a tweet saying, out of 146 samples tested, 40 positive cases of COVID-19 have been confirmed, 39 in Dimapur and 1 in Perin. He also informed that 14 COVID-19 patients from Perin have recovered. However, the recovered patients will be kept under strict surveillance, the minister informed. As per the DIPR report, the Office of the Chief Medical Officer Perin also confirmed of one COVID positive case being reported, believed to be a security personnel. The report also mentioned of one case of TrueNat test positive and confirmation for which is awaited, and one case of TrueNat positive but ICMR negative. The report said that contact tracing has been activated and active surveillance is being undertaken in Perin. With 138 out of the total 236 cases from Perin, there are now 98 active cases in Perin, which has seen the second highest number of positive cases after Dimapur. One patient is mild as per the severity of the case. And as far as the districts are concerned, Dimapur has reported the highest number of coronavirus infections with 379 as of 3 p.m. this afternoon. A total of 161 patients have recovered, while active cases stand at 218 with the addition of 39 new cases today. In terms of district-wise domicile data of positive cases, Perin has reported the highest with 313 cases, followed by Dimapur with 279, Kohima with 112, Mon with 108, Twensang 49, Fek 18, Wokai 11, Zinaboto 7, Mokokchung 5, 4 each from Kifri and Longleng, and others 46. The overall tally of COVID-19 positive cases from the state as of 3 p.m. this evening stand at 956 with 405 recoveries and 551 active cases. Recovery rate stand at 42.36%. Meanwhile, State's Health and Family Welfare Minister Assam tweeted to inform that he is in constant touch with the technicians and workers of BSL-2 lab at Twensang. He assured the people of the region that the lab will be operational at the earliest possible time and expressed his gratitude to all the workers for working tirelessly. With a record single-day surge of 34,956 cases, India's COVID-19 tally zoomed past the 10 lakh today, just 3 days after it crossed the 9 lakh mark, according to the Union Health Ministry data. The total coronavirus caseload in the country surged to 10,03,832, while the death toll mounted to 25,602, with the highest number of 687 fatalities recorded in a day. The updated data at 8 a.m. showed. A total of 22,942 people recuperated in the past 24 hours, the highest number of recoveries in a day, taking the total number of recovered cases to 6,35,756, while there are 3,42,473 active COVID-19 cases presently. Thus, around 63.33% of patients have recovered so far, an official said. With this, India has become the third country after the United States and Brazil to cross 10 lakh COVID-19 cases. Maharashtra has reported the highest number of cases, followed by Tamil Nadu, Delhi, Karnataka, Gujarat, Uttar Pradesh, and Telangana. The number of COVID-19 cases has gone up to 19,754 in Assam. A total of 2,283 people have been infected by the virus in Tripura. 1,764 in Manipur. Arunachal Pradesh reported 543 cases. Meghalaya 377, Mizoram 272, and Sikkim has registered 243 infections so far. The overall number of global COVID-19 cases has topped 13.8 million mark, while the deaths have increased to more than 5.89, according to the Johns Hopkins University. As of this morning, the total number of cases stood at 1,38,669,000, while the fatalities rose to 5,89,879, the university revealed in its latest update. The US accounted for the world's highest number of infections and fatalities at 35,74,371 and 1,38,339 respectively. Brazil came in the second place with 20,12,151 infections and 76,688 deaths. In terms of cases, India ranks third, followed by Russia, Peru, Chile, Mexico, South Africa, the UK, and Iran, making up the top 10 countries infected by the virus. The other countries with over 10,000 deaths are the UK, Mexico, Italy, France, Spain, India, Iran, Peru, and Russia. In other news, Assam Chief Minister Sarbananda Sonowal visited the flood-affected areas of Kaziranga National Park and took stock of the situation. As many as 66 animals have died and 170 others have been rescued from the flood-hit Kaziranga National Park, an official said yesterday. The flood situation in Assam is very grave this time. At least 28 districts of the state have been affected due to floods. At least 80 people have lost their lives due to flood, erosion and landslides in the state, Sonowal said in a statement. Stressing on the relief measures taken by his administration, the Chief Minister highlighted that the relief camps have been set up for affected people, where enough groceries have been stocked. People are being provided with masks, regular health checkups being conducted, and medicines are also being stocked for the affected people. Apart from these, domestic animals are also provided fodder, he added. The Chief Minister said apart from the flood, the state is also fighting COVID-19, and he thanked the people of Assam for their courage. The Kohima District Disaster Management Authority (DDMA) had a meeting on monsoon preparedness at DBDB's conference hall yesterday, which was chaired by Deputy Commissioner and Chairman of DDMA Kohima, Gregory Tejawele. Reviewing the last meeting minutes, DC said that the monsoon season has set in where maximum problems related to disaster occurs. It therefore called upon all line departments to be prepared as to cater the unfortunate problems that may occur. According to DIPR, on issues highlighted by the national highways in the last meeting pertaining to widening of national highways, the DC informed that NHIDCL has engaged some firms for repair and restoration of works. In regard to forest sector, several requests for cutting down the trees have been received which are posing danger to property and lives, where DC informed that the department issues permission. However, the clearance activities does not fall under the purview of the SDRF as per the guidelines issued by the NSDMA. He therefore said that this area has to be sorted out for clearance activities. On setting up of the Village Disaster Management Authority (VDMA), the DC informed that more than 90 recognized villages are on the Kohima district, whereas only 10 villages have formed as per the last meeting minutes. He therefore sought more efforts in this matter through the initiative of the area administrative officers. As a follow-up action plan for monsoon preparedness, DPA Kohima Victor Yome was entrusted to coordinate with line departments and conduct a spot verification drive and oversee all water drainages and outlets, especially in the municipal areas and premises of the government offices, after which a concrete activity plan would be mapped to mitigate any possible monsoon damages. ADC and Administrator Longleng Town Council D. Robin in an order stated that in pursuance to the national directives for COVID-19 management and in continuation to the earlier order of the ADC and Administrator Longleng Town Council, dated 10th May 2020, all concerned have been directed to adhere to the following guidelines: compulsory wearing of face cover or mask, strict maintenance of social distancing, provisions for hand wash sanitizations in shops and business establishments. Further, the following activities are hereby strictly prohibited with immediate effect: smoking in public places, spitting in public places, consumption of liquor, pan, gutka, tobacco, etc. in public places. Well, that's all we have time for in this edition of News Broadcast. But before we leave you, here's another reminder that you can send in your videos at the WhatsApp number given below and be part of the venture of being a citizen journalist. Do let us know what's happening in your village, your town, your district or your locality so that we can share your videos to the rest of the viewers watching this broadcast. Meanwhile, stay safe, practice safe health hygiene and maintain social distancing wherever you are. But most importantly, take good care of yourself. Thanks for watching.